A new nutritional mindset for 2-month-old infants. Prioritizing quality over quantity. Introduction. Establishing the issue of heightened nutritional demands at 2 months. The 2-month mark is one of the most significant developmental milestones in an infant's first year. This is not only a time of rapid physical growth, weight gain, head circumference, but also a period of extraordinary neurological and cognitive development, starting to smile, making eye contact, recognizing voices. This explosive surge in growth, often referred to as a growth spurt, places a heightened nutritional demand on the infant. However, this heightened demand is often misinterpreted. Parents and caregivers frequently mistake the baby's constant nursing, fussiness, or frequent waking for insufficient milk supply or poor quality milk, leading to the misguided decision to introduce solids too early or switch to formula unnecessarily. From the perspective of a nutritional and pediatric expert, we assert breast milk and formula remain the sole, perfect source of nutrition for infants under 6 months of age. The issue is not the introduction of other foods, but rather optimizing the quality and efficacy of the current milk source to meet the higher demands for micronutrients and caloric density that the baby requires. This article will provide an intellectual framework and a sustainable lifestyle mindset to address this challenge. The scientific perspective. Core biology and nutritional needs at 2 months. To effectively meet the baby's higher demands, parents must grasp the underlying biological processes. The biological basis of heightened demand, rapid neurocellular development. In the first 2 months, the formation of myelin sheaths and synapses, neural connections, is intense. This process requires significant amounts of long-chain polyunsaturated fatty acids, especially DHA, docosahexaenoic acid, and ARA, arachidonic acid. This heightened demand is fundamentally about fat quality for brain development, immature digestive system. The infant's enzyme system, such as amylase for starch digestion, is still weak or not fully activated. Consequently, the baby's stomach and intestines are engineered only to process milk, with proteins, whey, casein, and fats in their most digestible forms. Introducing solid foods at this stage is a risk that can lead to indigestion, allergies, and mucosal damage. Immune window of opportunity. The infant's immune system primarily relies on maternal antibodies, IgA, IgG, continuing to provide immune factors, prebiotics, and postbiotics via breast milk or advanced formula is critical for building a healthy gut barrier during this window period. Key nutrients focus at the 2-month mark. Though milk is the primary source, its composition must be optimized. Component primary role demand level at 2 months energy, calories. Fuels growth and basic functions. Increased, approx $110, $120 or text-to-cal kgs day, depending on the infant. DHA ARA builds brain structure, vision, and the nervous system. Very high. Requires prioritization in maternal diet or formula. Protein builds muscle tissue, enzymes, and hormones. Needs an optimal whey-casein ratio, close to breast milk for easy digestion. Vitamin D supports calcium absorption, bone growth, and immunity, often insufficient through milk alone. Requires direct supplementation, iron supports blood production and cognitive development. Demand starts to increase. Requires monitoring, especially for exclusively breastfed infants. Why standard milk is often deemed insufficient, the quality issue. Breast milk. The quality of breast milk, particularly its content of DHA and vitamin D, directly reflects the mother's diet, lifestyle, and health status. If the mother is deficient, e.g. severe dieting, lack of sun exposure, the milk may be nutritionally insufficient despite being adequate in volume. Basic formula. Many standard formulas meet basic energy and protein requirements, but often lack the advanced bioactive components, like HMOs, MFGM, that pediatric science now recognizes as essential for comprehensive infant development. 3. The knowledge value. Strategies for optimizing nutritional quality to effectively meet the baby's heightened demands. The solution lies in improving the quality of the milk source through informed parental intervention. Optimizing breast milk strategy, mother-centric approach. The mother is the perfect nutritional factory. Optimizing breast milk quality is the best way to address the baby's higher needs. Maternal nutrition, the micronutrient. Foundation boosting smart fats, DHA, EPA. The mother should supplement with $200-300 text-to-$1 of DHA daily. This can be achieved by eating fatty fish, salmon, herring, 2 to 3 times a week, or using high-quality omega-3 supplements. The DHA content in breast milk will increase directly, providing optimal fuel for the baby's brain. Ensuring vitamin D. The mother should take vitamin D, approx $604,000 or text IU day, and or get safe sun exposure. While vitamin D is difficult to transfer in high amounts through milk, maternal sufficiency supports overall health and indirectly sustains milk production. Hydration and caloric intake. Breastfeeding mothers need to consume an extra $300-500 text-to-$1 daily and drink at least 3 to 4 liters of water. Dehydration is the leading cause of reduced milk volume. Supplement optimization. Continue using prenatal-postnatal multivitamins to ensure adequate intake of iodine, choline, and iron bi. Scientific breastfeeding technique, maximizing absorption efficiency. Emphasizing hind milk. Breast milk has 2 phases: foremilk, thin, high in lactose, and hind milk, thick, high in fat and calories. To meet the high energy demand of a 2-month-old, the baby must fully drain one breast to receive the nutrient-dense hind milk. Switching breasts too quickly provides only foremilk, making the baby hungry sooner and leading to fussiness, which is often misinterpreted as low supply. Managing growth spurts. Around 6 weeks and 3 months, babies may demand to nurse constantly. This is a natural feeding frenzy designed to signal the mother's body to increase milk production. It is not an indicator of insufficient supply. The mother must patiently meet these demands without immediately resorting to formula. Optimizing formula strategy, informed choice. For babies on formula or combination feeding, the choice of formula must go beyond the basic requirements. Advanced bioactive components. Parents should look for formulas fortified with components that bridge the gap to breast milk. HMOs, human milk oligosaccharides. These complex prebiotics nourish beneficial gut bacteria, supporting intestinal immunity, where 70% of immune cells reside. MFGM, milk fat globule membrane. Studies suggest MFGM, rich in complex lipids and proteins, supports cognitive development and reduces the risk of diarrhea. Probiotics, synbiotics. Beneficial bacteria supplements to aid digestion and mitigate issues like infant colic, which is common at 2 months. Precise preparation technique. Strictly adhere to the manufacturer's instructions. Preparing the formula too diluted leads to caloric and nutrient deficiency, failing to meet the high demands. Preparing it too concentrated risks indigestion, constipation, and potential kidney strain. Fancy lifestyle mindset. Redefining enough and holistic. Solutions intellectual education must be coupled with a shift in lifestyle mindset to empower parents to nurture their child with science and self-confidence. Redefining enough. Based on scientific evidence, parents must shift their measure of sufficient milk from emotion, baby crying, to objective data. Common misconception, scientific standard, redefining enough. Baby cries after feeding, milk is insufficient. Consistent weight. Gain. Weight and length track within the WHO growth chart limits. Baby demands to feed after 1 hour, milk is thin. Wet diaper count. At least 6 to 8 wet diapers per day, with pale urine. Breasts feel soft after feeding, no milk left. Bowel movements. 3-4 soiled diapers per day for breastfed infants. Not seeing milk spray, low supply. Swallowing reflex. Clearly hearing the baby swallow, steady suck-swallow rhythm during feeding. If the baby meets these scientific standards, any fussiness or frequent demands are likely emotional needs, comfort-seeking behaviors, or non-nutritional symptoms, e.g. gas, fatigue, mild reflux. Breaking down. Psychological and social barriers. The pressure for perfect motherhood, especially regarding breastfeeding, can induce stress and negatively impact milk supply. Handling social pressure. Remember that only a pediatrician or certified lactation consultant has the authority to assess milk sufficiency. Learn to trust your body and your baby over anecdotal advice. Parental mental health. Parental stress and sleep deprivation increase cortisol, which indirectly affects milk production and feeding interactions. Prioritize mental wellness. Sleep when the baby sleeps, delegate tasks, and practice mindful feeding techniques. A healthy parent equals a healthy child. Holistic nutritional solutions beyond the milk. The 2-month-old's heightened needs must be supported by environmental factors and external supplements. Direct micronutrient supplementation. Vitamin D. The standard recommendation for exclusively breastfed infants is direct supplementation of $400 or text IU dollars of vitamin D daily, as directed by a pediatrician, regardless of the mother's diet. This is a crucial element for bone development. Iron, generally not needed for full-term infants up to 6 months, but should be closely monitored with a doctor, especially if the mother has a history of anemia, environmental impact and connection, skin-to-skin contact. Stabilizes the baby's heart rate and breathing, reduces stress, and optimizes the rooting and suckling reflexes. This makes the feeding session more effective and improves nutrient absorption. Managing gas and colic. Proper burping techniques and gentle tummy massages are essential for reducing gas, a common cause of post-feeding fussiness that is often mistaken for hunger. Building a sustainable lifestyle mindset for parents. Mindful feeding. When breastfeeding or bottle feeding, be fully present. Put the phone away. This not only enhances the mother-infant bond, but also helps the parent accurately recognize the baby's subtle cues of satiety, discomfort and tiredness, flexibility and realism. Accept that nutrition is not a rigid formula. Occasionally, supplementing with formula at night can ensure better sleep for both mother and child, indirectly restoring health for both. This flexibility is a key component of a smart lifestyle mindset. B. Conclusion. The expert message that heightened nutritional demand of a 2-month-old infant is a biological reality reflecting their phenomenal rate of development. However, meeting this demand does not involve rushing to introduce solids or questioning the milk supply. The core intellectual and lifestyle mindset message is, milk is perfect. Quality must be optimized. Focus on improving the micronutrient profile of the milk via maternal diet or choosing advanced, fortified formulas with HMOs, MFGM. Redefine sufficient. Sufficiency is measured by growth charts, wet diapers, and stool count, not by crying. Holism is key. Nutrition must be supported by a calm environment, skin-to-skin contact, and the parent's mental well-being. Parents must equip themselves with scientific knowledge, trust their own bodies, the mother's ability, and their baby's cues, and always consult specialists, pediatricians, lactation consultants to meet the baby's heightened needs optimally and safely. Self-confidence and scientific understanding are the most solid foundations for comprehensive infant development.